The COVID-19 pandemic is considered as the most crucial global health calamity of the century and the greatest challenge that the humankind faced since the Second World War. In December 2019, a new infectious respiratory disease emerged in Wuhan, Hubei Province, China, and was named by the World Health Organization as COVID-19, a global health pandemic, economic turmoil, and environment hazard.
The COVID-19 pandemic is posing enormous challenges at every level of society and across economic sectors. Despite occasional rhetoric to the contrary, there is never a simple trade-off between health concerns and economic ones. Rather, there are many actions to take across a wide health care and economic spectrum that deliver positive outcomes about COVID-19 as well as social and economic resilience. For solid waste management, municipalities and local government units are faced with the challenge of continuing essential services of waste collection and management, while at the same time accounting for growing streams of potentially infectious waste and protecting the lives of formal and informal workers. One of the things that LG should do is to use existing waste management systems to their fullest whenever possible.
Medical experts scrambled to find an immediate cure but proved to be futile for now. Thus, preventive mechanisms developed to halt and lessen the spread and transmission of the virus. The use of personal protective equipment, face mask, face shield, and disposable gloves becomes of significance to prevent the deadly spread of the coronavirus.
COVID-19 has had serious impact on all parts of society. Waste management is no exception. Unlike the first world, waste management in developing countries like the Philippines have difficulty with a significant increased amount of potentially infected waste, which requires careful handling and treatment process.
However, this health kit becomes at risk if not properly disposed, resulting in endangering the health of the human lives and other living organisms.
Isang makakalikasang pagbati sa atin lahat. In view of this pandemic, this is how we should properly dispose our household hazardous waste na sinasabi natin. Dahil if we don't do this, we either become a problem to our community and also to the environment, rather becoming a solution. How do we dispose our waste? Or ang sinasabi nilang hazardous waste. First, in the community. Basically, for the face shield, hindi natin siya kagad tinatapon. Rather, we use it. That's why we also have to disinfect it with the use of an alcohol. So tip number 1, dapat may alcohol tayo sa labas ng bahay natin. For us to prevent, to mitigate yung virus na possible na pumunta sa loob ng ating bahay. Tip number 2, before entering in our household or sa bahay natin, we also need to remove our clothes. Dapat diretso na ito sa ating mga labahan or sa washing machine to prevent any viruses that will come inside of our houses. Next one is this one, washable face mask. The same din siya for our clothes, which is also needed for us to remove before entering our houses. And also surgical mask, one-time use only. As we remove it, we should also cut it before putting it in a specific garbage bag or plastic bag. Also for this one, it's the same for the surgical mask, which is a one-time use. Dapat din natin siyang i-cut before natin siya ilalagay sa ating mga trash bags or plastic bags. How do we dispose it? Basically, all of these things, we put it in a garbage bag. Black plastic bag or any plastic bag can be used as long as we have tape, a marker, which we will put a name for the kind of a waste. So basically for this one, I have put medical waste. You can also use infectious or hazard waste.
Hazardous wastes are waste or products that have the potential to harm humans or the environment, either now or in the future.